In the name of Allah, the most merciful, the most beneficent. Assalamu alaikum. Well, dear friends, I am going to discuss the surgical anatomy of the neck area. You know, a surgeon must be an artist. A surgeon must be an artist. As I told you, a surgeon is an artist of the human body. To be the best artist of the human body, the surgeon must know about the anatomy of the body. A surgeon must know very well about the anatomy of the human body. Until a surgeon is able to know the basic anatomy of the area on which he is doing surgery, he will not be able to perform the surgery perfectly. Rather, may cause many injuries to the normal structures while removing the disease structures. In my opinion, a surgeon is a soldier with a weapon in the form of a scalpel in his hand, with a small knife removing the diseased part from the human body. So, a surgeon is a soldier with a knife in his hand to remove the diseased part from the body, and thus is the protector of the body. Now let's suppose I draw a rough diagram of the body. This is head. This is body. This is root of the neck. And this part which connects the head with the body is called the neck. Now let me draw the neck, anterior part of the neck. You know, if I made the mandible like this, from below, here another bone, that is the mastoid. This is mandible. Another projected bone that is called the styloid process. These two are two parts of the temporal bone. Now this is midline. Here lies the hyoid bone. This is a bone which lies freely in the neck, suspended by muscles of the neck. Below the hyoid bone is the thyroid cartilage. Hyoid bone, thyroid cartilage. Below the thyroid cartilage is the cricoid cartilage. This is bone, hyoid bone, thyroid cartilage, and cricoid cartilage. They lie in the midline of the neck. Below that are the tracheal rings. Now here there is another bone that is called manubrium of the sternum. Manubrium of the sternum. The sternal bone, it's a part of that bone. From the sides, there are two bones on both sides, one on this side and one on this side. It's called the clavicle. The clavicle or the bone of beauty. Now this is the front of the neck. This front of the neck is divided by a muscle into two main triangles, the anterior triangle and the posterior triangle. The muscle has two heads of origin, one from the manubrium of the sternum, the other from the medial end of the clavicle. These two ends join to make a muscle and insert here on the mastoid bone. This muscle is called sternomastoid muscle, sternocleidomastoid muscle, sternocleidomastoid muscle. Here, more laterally, a muscle arises from the back of the head, the neck, and the thorax. A very big muscle. It arises from the back of the neck and head. That muscle is called trapezius muscle. Now, if you notice, this neck is divided into two main triangles. One triangle, this one, with the base made by the clavicle, by the mandible above, and the apex at the sternum. Medial border by imaginary midline, and lateral border by the anterior border of the sternocleidomastoid. While here, there is another triangle, it's called posterior triangle, the base of which is formed by the superior border of the clavicle, the apex at the mastoid, anterior border by the posterior border of the sternocleidomastoid, while the posterior border is made by the anterior border of the trapezius muscle. In this way, this triangle has the apex above and the base below, while the anterior triangle has the base below, above and the apex below. These triangles are called anterior and posterior triangles respectively. But in fact, in my view, these are not anterior and posterior. Rather, this one, which we call the anterior, is anterolateral, while this one, which we call posterior triangle, is in fact a posterolateral compartment. Anterolateral and posterolateral compartment. This posterior triangle is further divided by a muscle which arises from the dorsum of another bone, which lies here. That is called scapula. This muscle, there is a muscle which arises from this scapula and inserts here on a tendon. Intermediate tendon. This muscle is called inferior belly of omohyoid. Inferior belly of omohyoid muscle, which arises from the scapula, goes medially and upward and inserts on a tendon, intermediate tendon here. This muscle, inferior belly, divides this posterior triangle into a superior part and an inferior part. Now come to the anterior triangle. This anterior triangle is further divided into multiple more triangles. A muscle from here this comes like this. It's called anterior belly of digastric muscle. Digastric muscle. Digastric means something with two bellies. Here also it makes an intermediate tendons which passes through a fibrous sling attached at the body of the hyoid, and this muscle gives another part that is called the posterior belly of digastric muscle. Posterior belly of digastric muscle. In this way, these two bellies of the same muscle make a triangle in this area. This triangle is called digastric triangle or submandibular triangle. In the same way, if you see here, this is the midline, this is the anterior belly, and this is the body of the hyoid, superior border. Here also a triangle is formed. This is called submental triangle, if you see here. Here in the submandibular triangle or digastric triangle, the base is formed superiorly by the mandible, interior wall is formed by the interior border is formed by the posterior border of the interior digastric belly. Posterior border is formed by the posterior belly of digastric. Apex is the hyoid bone, while base is the mandible. Here, another triangle, the base is on the hyoid, apex is the chin. Here, medially it's formed by midline and laterally by the interior border of the interior belly of digastric muscle, and base by the hyoid bone. Now, there are the two triangles, 1 and 2. This triangle is called, this is the submandibular triangle. Better I will make like this according to the shape of the triangle, while this is called submental triangle. Submental triangle. I will make this like this because the submental triangle here, it has the apex above and the base below. Now the remaining part of the anterior anterolateral compartment here, as I mentioned before, the other part arises from this tendon and attaches here at the lower border of the hyoid bone. This is called the superior belly of omohyoid muscle. Now, if you notice here, another triangle is formed. That is formed here by the posterior belly of digastric, here by the upper part of the sternocleidomastoid muscle, while here the base is formed by the superior belly of omohyoid muscle. So this triangle is called Carotid Triangle. Now, if you notice, this area is left. This part is called muscular triangle. it is not in fact a triangular shape, rather it's a quadrangular shape because it has one angle here, one angle here, one angle here. So it's a bit quadrangular, but irregular shape quadrangular. But we call this muscular triangle because most of the muscles lying below this hyoid bone, which are called infrahyoid muscles, are located in this triangle. So this is superiorly bounded by the hyoid bone, inferior border of the hyoid bone, medially by the midline. In this part, it's made by the anterior border of the superior omohyoid belly, and here in this part by the anterior border of the lower part of the sternocleidomastoid muscle. Now these are the triangles, different triangles. Now the different contents of these triangles, starting from the submandibular triangle. Here the most important thing is a gland, the submandibular gland. The submandibular gland. Here the most important thing lies is the submandibular salivary gland. Other important structures are the lymph nodes, which lies on this gland, superficial part of this gland, and other lymphatics and lymph nodes in this area. It also contains facial vein coming from this face in front of this gland that lies superficial to the gland. While another important thing is the facial artery, which lies deep to this salivary gland. Come to the submental space usually combines with the opposite side to make a single space or triangle that does not contain significant structures except submental lymph nodes. Here come to this third triangle, the carotid triangle. This is very important triangle because it contains the internal jugular vein, the common carotid artery, the bifurcation of the common carotid artery into internal and external carotid arteries, the branches of the carotid arteries, external carotid arteries, the carotid sinus, carotid bodies, and the nerves, hypoglossal and the vagus nerves lies in this carotid triangle. Now come to the anterior triangle. Here in this triangle, here lies the important gland that is called the thyroid gland. On the back of the thyroid gland, there are the parathyroid glands. These are the important structures with lymph nodes, paratracheal and prelaryngeal lymph nodes also lie here. Now the different muscles which lie here, the thyroid muscle. In this triangle, this is thyroid, the muscle joins from the superior border of the thyroid cartilage to the inferior border of the hyoid bone. This is called the thyroid muscle. Another muscle is the omohyoid muscle. See here, thyroid and omohyoid. Then the sternohyoid, a muscle arises from the sternum and attaches with the inferior border of the hyoid bone. It's called the sternohyoid muscle. And another muscle which arises from here is the sternothyroid muscle. One muscle attaches from the sternum to the hyoid bone, other from the sternum to the thyroid, sternothyroid. Now this triangle, the significance of this muscular triangle is that we do surgery. Most of the surgeries in the head and neck and the neck region are done for these structures. In this muscular triangle, like thyroidectomies for thyroid removal, parathyroidectomy, like laryngectomies, like tracheostomy, we make a hole here. So for reaching to, approach to these structures, we have to split these muscles which are called infrahyoid or strap muscles, we split or retract these muscles to expose this area for the surgery. After this, another important triangle is this one. The submandibular triangle has also a great significance for removal of this gland. So I will elaborate this submandibular triangle a little more. Let me clean this.